Hi, my name is Dan. I'm really into the outdoors and adventures in the outdoors. What I really love here at Hope and Healing is I especially work with teens and with young adults, and then also with parents. And I've worked with teens for a while, and I just love working with them. I have a few child clients, and I really love working from an attachment perspective and just thinking about early developmental trauma and how that impacts us and impacts our relationships.
Hi, my name is Susanna Anderson, and I'm a therapist here at Hope and Healing. So as a therapist, I work with a whole bunch of different people, but I specialize in working with kids and adolescents, young adults, and then I end up working with parents a lot too. And I specialize in developmental trauma, working with kids who have had rough starts and experienced a lot of hard things. I love working with kids and their parents and just helping them make sense out of their stories and what's happened to them so they can live happy, healthy, productive lives.
Hi, my name is Heather Abbott. I'm a clinician here at Hope and Healing. I work mostly with kids and I do a lot of parent work as well. I'm also a mom myself, so I have mostly teenagers who've been through lots of phases of parenting. I've been here at Hope and Healing for about 2 years, and I would say that my clientele mostly ranges from 7, like kid-wise, from 7 to 20, and then I see plenty of parents do parenting work.
Hi, I'm Amberly. I am a licensed clinical mental health counselor here at Hope and Healing Child and Family Counseling. A little bit about me. I'm originally from California, born and raised. I moved to Arizona right after high school to get my bachelor's degree in psychology and sociology. Then I moved to Colorado to get my master's degree in counseling psychology, and then I moved here to Utah. After I moved here, I got married and recently just had a baby in this last year. She's 10 months old. She's so cute. So a little bit about where I work here at Hope and Healing and what we do. So we are a clinic that serves children, but we mainly focus on trauma. So we also see a lot of foster care and adoption kids. So with those kind of kiddos, you have lots of trauma. And we utilize and implement and teach this concept called TBRI, which is Trust-Based Relational Intervention. And so that is a type of parenting that we use here and we teach and we help kids heal through that type of approach.
I'm Katie Rollins, ACMHC here at Hope and Healing, Child and Family Counseling. I've been here for about 4 years. I've worked with ages as low as 18 months and up. I am a wife and mom, and I really liked to include yoga into my therapy. It's something I really believe in and believe that can be helpful for our healing.
All right, so one thing I wanted to talk about is what are some things we can do to help kids be open with us and feel like they can ask those big questions?
When I think of big questions, I think that big questions are made up of little questions. But that doesn't always fit into the schedule. And so part of that is we need to be able to slow down. We need to be present, which means we have to make time for being with our kids. And if something comes up, trying to figure out what is it they're wondering. Not so much what is it I want to tell them, but try to understand what are they really asking, not just what I want to communicate.
That's great. And it sounds like for tuning into them and making sure there's time for those questions, a good thing too is if you have like a lot of kids or even just more than one, to make sure there's that time with one-on-one so that they can feel like you're tuned into them and not into the crowd.
Yes. And that can be difficult, especially if there's lots of littles.
Yeah.
And it's so important and to be able to make that time.
All right. And then something else we want to talk about is what are some things we can look for, some signs that a child has a trauma or something they're struggling with that they haven't talked to us or opened up about, but that needs to be addressed.
Yeah, that's also a really good question. I think the first thing that comes to mind is when they're having behavioral issues or there's something going on, they're acting out in a certain way or they're doing something funny and something that you would say is maybe abnormal or unusual. I think that is a really big sign. through my eyes, I think all behavior is communication.
I would look for changes in behavior. So if a child starts acting out where they didn't used to, or they start being more withdrawn where they had been more outgoing before, if your child suddenly stops sleeping well at night or starts having nightmares, generally when there's a trauma, it becomes a pivot point for a child. So things are going along just fine, something happens, and then there's an effect from that. And usually if you're paying attention to your child's behavior, you'll be able to see that something has changed.
Okay, so then the last thing I wanted to ask you about is just your advice for how do we know when it has gone beyond what we can help with as parents or just adults in a child's life, when whatever they're struggling with needs outside help?
So I think whenever there's a trauma in our lives, that is always a good time to just get some professional advice or support. But I think whenever there's an consistent, overwhelming feeling, and we're talking to friends or family, it's probably best to get some professional help. Friends and family have great advice, but they also have a lot of their own opinions that can be harmful at times.
Yeah, sometimes they don't have great advice. Okay, that's good. So yeah, if you're feeling overwhelmed, like you aren't able to handle it, then there's no way the kid's being able to handle it.
Right, and if it's a consistent thing, right, like we all have overwhelming days, but if you're consistently feeling overwhelmed with a specific one of your children or your child and your relationship, I think that's a big one too, is if your relationship with your child is starting to suffer, that would be a very good time to get some support.
Thank you.